Hey guys, my name is Jim Rynerson, and what I'm going to talk to you guys about today is fixing, dare I say curing, blepharitis and dry eye disease. Now, I don't use that word cure carelessly or haphazardly, because using a new protocol we've developed and a new device we're bringing to market, I am doing that every day on my patients in my dry eye clinic in Nashville, Tennessee. And it's really not that difficult. It's really all about understanding one thing, really. It's simple. Biofilm. And you understand biofilm and how it causes chronic lifelong disease, you'll understand the nature of blepharitis and dry eye disease. And once you understand what causes it, you can fix it. And I'm going to show you how I do it. Some of you may already know me. I presented at this conference 4 or 5 years ago and presented BlephX, which was the first biofilm removal tool for getting rid of the biofilm that grows on the lid margin. We've got to get that taken off as a first step towards any dry eye treatment, because the biofilm in the lid margin acts like a layer of saran wrap. So no matter what you're doing in terms of dry eye disease, if you don't remove the saran wrap, you're not going to get anything out of the meibomian glands. So the first step is debriding the lid margin and getting rid of the biofilm. Secondly, I introduced a lash cam a couple of years later that allows the patients to see up close and personal their lid margin disease, and they typically don't like seeing that. They become motivated patients. The lash cam also gives great meibography pictures so you can evaluate the meibomian glands, and you can see the oil acini. I call it cobblestone, and you can see it in these glands here, those little white circles, those little cobblestones. That means you've got viable glands that are going to give us great oil once you remove biofilm and attack the biofilm in other places as well, and that's what this presentation is about. So the new protocol I'm using is called the REV protocol, which stands for Recognize, Exfoliate, Vaporize, Vibrate, and Express. And this allows us to put this dry eye disease in remission. How do we fix it? Well, we have to recognize it first. We've fallen short in that regards for many, many years. Then we've got to do a BlephX. We have to remove biofilm from the lid margin, then vaporize, and then mobilize. Now, the recognition part, we figured out a really easy way to do this. It doesn't require any expensive machinery or any testing, really. It's this red line you'll get if you look at the upper lids of all your patients. You've got to expose that red line, though. It's not right there. We've never noticed it before because, you know something, we don't examine patients with their eyes closed. It's always open your eyes, look at my ear, and as soon as that eyelid is open the least bit, you've got folds of that upper lid, that excess skin will block that red line just like that, and you'll never see it. And we never look for it, but it's there. Easiest way to diagnose this disease. So patients walk in with all this multitude of symptoms. Doctors don't know what to do, exactly what it is. Let's test this, let's test that. No, it's easy. You just got to pull that skin up on the upper eyelid. And this red line correlates absolutely perfectly with the disease of meibomian gland destruction you're going to see in the eyelids. And you can look at these pictures. Which eyelid has the worst red line was over here on our right, and it also just so happens to have the worst meibomian gland disease as well. You will see that across the board. All you got to do is pull up. Now, there is a device you need to do this, and we both have one of them on each hand. It's called a thumb. And you got to lift the skin and stretch the skin. Not just lift, but lift and stretch, because the finest little wrinkles will hide that sign. So now we can instantly diagnose our patients with meibomian gland disease. The front desk can do it. Your technician can do it. Have that picture sitting there on the desk for the doctor to see when he walks in the lane. So we're going to be able to diagnose all patients now with MGD, even if they have no symptoms. And that's the key. That gets an earlier diagnosis, and we can make an earlier intervention. OptiVize is what allows us to take the next step. So recognize, exfoliate, that's the E in REV, that's with the BlephX, and then the first V is vaporization. OptiVize allows us to use 6 volts of current to safely and almost without feeling to the patient vaporize biofilm, not on the lid margin, but where? Down within the meibomian gland, because bacteria, they can go anywhere they want. They colonize the glands. They build biofilm in there as well, and they create inflammation in there as well. And it's that intraglandular inflammation that destroys these meibomian glands and makes patients miserable. It uses a little specialty contact lens. This little shell here, kind of like a little scleral shell, goes over the globe, touches the eye. The lids close around it, so the lids come down and contact this metal shelf over here. I wish I had a pointer on here. Maybe I do. No, I don't. I'm just advancing. So you have a metal shelf. Right behind that shell, the lids close onto that metal shelf, and that's what conducts electricity in through that wire and then out the metal shelf directly into my meibomian glands, vaporizing biofilm, and the patient barely feels it. It's 6 volts. It's 4 AA batteries. And it does an amazing job of that. And then this little shelf also has a little IV port on the back of it, you can see there. That's for bringing in a line of saline that drips out through those 2 little teeny holes you see on the upper and lower side of that shelf, on the bottom side as well, to keep that eyelid moist and keep good contact, good vaporization of biofilm. Now, you think, vaporizing biofilm, what the heck is he talking about? Well, I learned about biofilm vaporization from Montana State University. They grew a biofilm on a metal plate. It's a white biofilm. It's on a metal plate. They attached that metal plate to grounding rods. Then they ran in a copper wire and put the whole thing in a saline bath, a saltwater bath. So they flipped the switch. The current goes through the wire, through the saline, through the biofilm to get to the metal plate. That's the ground, right? Here's what happens when you flip the switch, if this works. Here we go. My most favorite video of all time. There's our enemy. It blows biofilm into millions of particles, millions of little granules of sugar. That's our enemy, that white biofilm. That's what causes dry eye disease, otherwise known as blepharitis. Blepharitis is the same thing, right? You know that, right? Blepharitis chronically leads to dry eye disease. That inflammation is what kills the glands. So biofilm produced by bacteria allows bacteria to begin producing toxins, and that leads to the chronic inflammation. That's why getting rid of biofilm is critical if we're ever going to fix this disease, and we can do it. First ever picture of biofilm vaporized from an eyelid. Now, I don't have a pointer, unfortunately, so I can't really point it out well, but if you look at this picture over here, the left half of what you see on the eyelid there, you see little granules, little particles. Those are the sugar particles. That used to be part of this mass called a polysaccharide biofilm. And you see it's completely different in nature than the white line over to the right, which is early expression of the oil, of the sludge. Completely different in nature. Sugar granules are not soluble in oil. So you see how they stay separate? They're soluble in water. So they stay separate, and they show up separately, and you can actually see that when we express these lids in the very early stages. Now, of course, later on during the expression, if it's done atraumatically, you're going to get this great return of the sludge then on those glands. The other half of OptiVize, the right-hand half, controls this little expression device, uses a little magnifying lens so we can actually visualize what comes out of the glands. And that's really critically important to following these patients. We've got to see what comes out of there. Is it paste? Is it sludge? Is it cloudy oil? Is it clear oil? This not only allows us to see what comes out, it heats, and then we have a vibratory disc on the outside paddle that as soon as we hit 39 degrees, the doctor steps on a pedal, activates the vibratory disc, and now for the first time ever, we're doing a vibratory expression. And everything comes out of there. Any of you guys in here who are old enough might remember this old game we had as kids. It was a football game, a metal sheet, and football players were on there, and you flip the switch and the metal sheet vibrates. Anybody that old in here, or is it just me? Nobody remembers that game? All right. Anyway, it just shows, it illustrates the power of vibration in mobilizing things. Most effective and efficient expression ever. And it works. Here you go. There's a red line on this eyelid over here. You all are trained now. You can see this red line easily. After 5 treatments, it disappears. We have eliminated deep subdermal blepharitis. Left eye, the same thing, gone in 5 treatments. Here's a patient who was really unhappy when she came in. She had seen everybody in town, and look at this. Now, this is the worst inflammatory patient I've had to date. Everything's inflamed, all the way up into her forehead, the eyes, the lids, everything. She was miserable. She couldn't go outside and garden. She couldn't go boating with her husband. This lady was actually contemplating suicide, thinking, what's the point of living? I can't enjoy anything in life. 6 treatments later, look at her. She says, I got my life back. This is a life-changing treatment with these patients who are chronically miserable, and we can now do something about it. Progress in as soon as 3 months. Look at the red line going away. Still there in the 3rd month, but you see how much less it is as that inflammation just melts away. We did a study, looked at 312 eyes. T-butt increased by an average of 6 seconds per eye. Speed scores dropped from 17 all the way down to 6. 0 complications, 0 adverse effects. And coming soon, next year, we're sticking with our devices, but now we're going to delve into the artificial tear market with a new product called Quell, 84% improved comfort compared to standard tears. Redness reduced by 53%. Relief lasted average 6 to 8 hours. 0 adverse reports. Secret ingredients are emu oil. Don't tell anybody about that. Emu oil is amazing stuff. Terminalia tubula is an anti-biofilm product. And coming out next year. So we're excited about that as well. This is how you fix dry eye disease. You got to have these products. I'll be around to answer any questions. Thank you guys for hosting me. Appreciate it.